Hello to all of you and welcome to Medi-Gyn podcast. Medi-Gyn is a hormone balancing center situated in Dubai, originating from the south of France and Monaco. And we offer hormone balancing solutions for any of you, anywhere, at any age. And today we are talking about one of the ways of dealing and adjusting and balancing your hormones, which is through peptide therapy. And with us today, I'm Irina Bond, a founder of Medi-Gyn Center, and we are speaking today with Dr. Khalid Shukri, who is a doctor of biointelligent medicine, who is also a doctor of regenerative medicine and functional medicine with 40 years of experience. So lots to talk about, a great topic, peptide therapy. So Dr. Khalid Shukri, hello to you.
Hi, welcome.
Thank you for coming and joining us. So Dr. Khalid, what are peptides? We know a little bit about the terminology, but what are they really?
So, peptides in human are tiny natural proteins, and they are in our body. It sends messages or signals to the cells um, for a number of functions like healing, repair, immune modulation, boosting the energy, balancing the hormones. There are many functions, but these are the main.
The main ones. So tell us, what is the difference between peptides and protein and amino acids? Is there any difference at all?
Yes. Okay. So, amino acid, when you have the proteins are amino acids actually. So if you have amino acids more than 50, you're considered as a protein. And if it's from 2 to 50 amino acids, then it's considered as a peptides. And when it comes to peptides, you have two types, peptide therapy and peptide therapy, which is from around 5 to 49 amino acids, and then less than 5 will be around peptide bioregulators.
Okay, very interesting. So, Dr. Khalid, some peptides, there are different types of peptides, and there are different types of how we use them and for different types of in our body. So, what are the peptides are available for which function in our body or which part of our body? What are they?
So there are almost more than 100 peptides actually, which is used. About 80% are FDA approved, and they can be used in different ways. It can, as you mentioned, it can be used as a subcutaneous injection. It can be used as oral. It can be used as intranasal, and it can be used as topical. So it depends on the peptide, what type you're going to use. It can be whatever route of administration, depending on the type of the peptide. So the different types of peptides are various. The most common which we see is the insulin. Insulin is a peptide which is commonly we use it for diabetics, and it was the first peptide discovered more than 100 years ago. But as we go along for the last few years, we've seen the new peptides for weight management like Ozempic, Mounjaro, and but actually there are more than that peptides which are used in a better way and used more, which has more benefits like BPC 157, CJC 1295, which has numerous benefits compared just to having just one type of peptide which has one type of action.
Well, as you know, Medi-Gyn is a hormone balancing center for ladies, majority of the times. So talking about women's health, we talk a lot about it, and perimenopause, menopause. What peptides would we use really for those purposes?
So yes, for hormone balancing and for perimenopause, menopause symptoms, the most commonly used, which I see, and is the CJC 1295 slash apamorelin. You can add with it also BPC 157 for reducing the inflammation. The CJC 1295 has a good role in balancing the hormones, better sleep, better energy. BPC for reducing the inflammation. You can use also sermorelin and also GHKCU. There's numerous, but the most common I use for perimenopause and menopause is the CJC 1295/imapirolin.
Yes, I can confirm. I've used it and I've tried and tested, and it actually works wonders. Your energy, your libido goes quite up, and you feel great for it. So, CJC ipamorelin, BPC 157. What would you use for weight loss, for example, for while ladies gaining weight around the belly? Would there be those peptides or something else?
Yeah, I think it's important it's just not about prescribing peptides to see why they are gaining weight. So usually we, as functional medicine physicians and anti-aging physicians, is also to see the root cause and not to label the person the weight gain is secondary to perimenopause and menopause. We have to rule out other causes which cause weight gain, like poor detoxification. So if you cannot detox properly, then you're not going to lose weight. If you have hypothyroidism, which is uncontrolled, also can cause weight gain. So you have also leptin resistance, which is also missed in this case. Insulin resistance also can cause weight gain. So you have to ensure that this person has ruled out other causes of weight gain before they go ahead and start peptide therapy.
Yes, very true.
And
Well,
if you, just to add, just so the common peptide we use for the, you can use Manjaro, you can use BPC 157, you can use AOD. So these are the things we use, but usually we try to combine, usually because it has some benefit effect in synergistic way when they act together, 2 to 3 peptides in reducing the weight instead of using one type of peptide.
very interesting. So let's go back a little bit and see what is happening in our body once peptide gets into the body, once it's injected. What is the biochemical process that is happening there?
So it depends on the type of the peptide. So if you have CJC 1295 imapirolin, it stimulates the growth hormone. Okay, you have other peptides like MOTSI stimulates the mitochondrial health and more energy. You have BPC initiates to stimulate the angiogenesis and the fibroblast for healing repair. You have other peptides which can stimulate the mTOR pathway for anti-aging. You have apitalone can stimulate the telomere elongation. So you have different ways, but overall it is stimulating the signals of the cells to communicate much better, because as we age out, the cells communication will get decline. So this will enhance much better efficiency in the signaling of the messages of the cells throughout the body.
Yes, because peptides, as we know, they are used in practically all functions in our body, right? At what age can we expect that peptides will kind of start decreasing?
At the age of 18 years old, our epigenetics will be changed. So the lifestyle modification already starts at age 18, not so our aging already started from that. There's a trigger for the aging process. So if you ask me about the best time to use the peptides, it can be used anytime depending on the indication. So if someone has a disease like autoimmune, and you can use it earlier because it can make the disease in remission, and it also can reverse the condition. If you have a patient who is just coming from a musculoskeletal injury, you can use it. So it depends on the indication, depends on the age. There's no specific, but we try to use it in the adult age more than the age of 18, if there is an indication to use it. So it's very important you be assessed properly by a physician who is certified in peptide therapy.
So, for example, if a patient comes to you and would like to use peptides, what medical conditions, what tests do you take into account before prescribing anything, of course?
Yes. So you have first the conventional blood test, which is you have to identify if there is any inflammatory marker like CRP, SR, the liver function test, the kidney function. These are the basic, and the hormone, testosterone, DHA. So it depends on this. The second part is the functional medicine lab, which you want to do. If you can see your biological age, because some people don't see your biological age. You can see the mitochondrial health. You have to ensure that they don't have a leaky gut, so you're doing the GI map stool test. And also, at the same time, you have the third category is the quantum. The quantum. So the quantum is a good biomarker. It is a more advanced biomarker compared to the others because you identify the biofield and the information level, so you can track the response of the peptide more earlier compared to the other tests in functional medicine and conventional medicine.
My goodness, so all these tests in one go, or you would go one by one, step by step?
So yeah, so usually most patients they come, they already had their conventional blood test.
Yeah.
Okay, there's not mandatory for the client to do the functional medicine or to do the quantum, but we usually try to explain to them what's best for them.
Yes.
Okay, but if they just want to do the conventional, it's fine. What I usually try to explain to them is very important that whether now or later, doing quantum diagnostic scan is very important because peptide, when you use it, you have to use in a proper way, and you have to ensure that you're using the correct peptide. I'll give you an example. So if somebody has, if you do a blood test and you do functional medicine lab test, there's no indication of risk of cancer, correct? So if the person wants, and he has a history of family, history of cancer, and he just wants to be sure, or he doesn't have, that his cancer terrain are good, then he can do quantum diagnostic because some peptide may trigger, okay, which is not too many, but you have to ensure that what you're selecting is the proper one. So you have to be safe also.
I see, very interesting. So a lot of the times our ladies use and opt for functional medicine tests exactly for the reason that Dr. Khalid suggested and stated, for the to find that root cause of that condition. So many ladies of ours who come to Medi-Gyn Center, they have issues, of course, once they're going into perimenopause, menopause. This is gut issues and mitochondria, the energy levels, mitochondria issues. So what would you suggest for those ladies? Should they go for a normal conventional blood test or rather functional medicine tests?
Yeah, I would. Doing the routine blood test is conventional, is okay, but they have to remember that the blood test which we see the result in is a snapshot of the blood test which is done in conventional medicine, especially when it comes to hormones. So I would focus on functional medicine lab test for hormones more, for Dutch tests more better, especially for perimenopause and menopause. If they have issues with their gut, then I go for GI maps to test. For functional medicine lab is much better compared to the conventional because it tells you more the root cause, and because the blood test always, the conventional tells you, well, you're already sick, so it's not that time you have. So in perimenopause, menopause, functional medicine lab test is the best.
Yes. And would you suggest that ladies who are still in early perimenopause, they opt for peptides earlier on in the game, or they should really wait a little bit longer to assess the situation?
No, they can use the peptides safely with the correct, with the right physician who can prescribe it properly and assess properly the need of the client.
Maybe it's a little bit controversial question, but I would ask because it's interesting. Would any lady in the early perimenopause already feeling some symptoms, by using peptides, would she be able to prevent further symptoms from appearing in their body, from sensing them and feeling them?
Yeah, so if you rule out the primary causes and secondary causes of the perimenopause or pre-ovulatory failure, then the peptides can help the patient in relieving the symptoms. So maybe they can use 2 to 3 peptides for some time and see how they go and balance their hormones. So it needs a proper follow-up also. And
I know that usually peptides, for how long can we use them? For 2 months and then a break, we have a break, and then another 2 months, how would you suggest that peptides are used?
So I recommend that they can use for 2 to 3 months, and then they have a break of 1 month. Okay. Depends on the assessment whether they need a short term or long term. So usually we don't recommend them to take as a long term because there'll be desensitization, the body needs to heal by itself. So we use 2 months or 3 months and then 1 month break, and then they can repeat. Okay. And once they repeat the second cycle, they can stop for some time period and see how they responded. At the same time, if they went back to their ovulation and so on, that's fine. But at the same time, we have to ensure that the peptides work properly. If they have there's no heavy metal toxicity, the minerals and vitamins are well optimized, the detox pathways are all well. So it's not just giving the peptide, but to ensure the body is also healthy and optimal in order that the peptide can work efficiently.
Would you suggest any peptides for men as well?
Yes, we see men a lot, especially with musculoskeletal injuries. They come all for anti-aging. So we use a lot for BPC 157. We use thymosin beta or TB 500. These are the common two peptides we use as musculoskeletal injuries, which is the most common presentation I see on daily basis.
And a juicy topic like sexual health and libido, what would we use for that purpose?
For libido and ED, we use PT141. Can be used intranasal, but most commonly, more effective is by injection. And we use kisspeptin also.
Yes, exactly, because I've heard, and also during my preparation for the podcast, I've listened to one of the famous podcasts, and they were talking about nasal peptides, about under the tongue spray peptides, as well as injectable peptides. So which ones are actually more beneficial for us?
Not all peptides can be given the same route. I mean, say if you cannot give BPC intranasal at this moment, or you cannot give, so depend what is available in your compound pharmacy. Okay, so like those who have cognitive decline or anxiety or panic attack or ADHD, we use Sanac or Semex, which is intranasal. Okay, but it's not available on oral form. So it depends. So depends on every peptide. GHKCU for the hair and skin, they have topical form, they have injection form, they have shampoo form, they have oral form. Okay, so every peptide has different formulas how we can give them what routes.
And so we have peptides, injectable, and we have peptides bioregulators.
Yes.
So what is the difference between those two?
So peptide bioregulator, when the amino acid is around 2 to 5 amino acids, or 2 to 6 amino acids, while the peptides are the bigger ones, which has about from 6 or 7 up to 50 amino acids. So the peptide bioregulators are tiny. Peptide is very, very tiny, and it's used as oral form only. And how it works, it goes directly to the inside the cell, compared to the peptide therapy is only at the cell wall where they transmit signals, but the peptide bioregulators inside the DNA, where they have the ability to switch off and switch on the epigenetics of the DNA. So if the person has, say, hypothyroidism, he can restore the balance of the thyroid by giving the peptide bioregulator. But we have to ensure that using the peptide bioregulator, we use also, it's organ specific. So it's not general, it's organ. So they have, each organ has a specific peptide bioregulator, and we use it usually combined with a peptide bioregulator for the vessels, because vascular health is important for the blood supply of each organ. So it's a combination.
Interesting. So peptides bioregulators, are they available anywhere? We can purchase them anywhere, or you would suggest a specific, usually place where we can purchase them?
Yeah, so you have to ensure whether it's peptide therapy or peptide bioregulators, you have to ensure that you're taking from a valid source, Not everything in the market or in the online it is safe.
Yes.
It should be well researched, authentic, high quality company brand, and third party investigation. So the clients have to be sure, and also it's very important that the physician prescribing has to know which the best source they can take it from.
Yes, exactly. One of our patients recently purchased peptides, not with us. She's with us for a very different reason. She purchased peptides in a powder form. What would you think about those peptides?
Most of the powder forms are from a research labs.
Mm-hmm.
So I cannot give a comment at this moment. But usually, if you can mix it with sterile, but I think it's very important to have a compound pharmacy.
Mm-hmm.
Better than compare just buying online and then just mix it with because you don't know what's the source. Is it the real powder or peptide or not? So I advise prescribed by a doctor,
Yes.
and it should be from a compound, valid, high quality brand compound pharmacy.
Yes. So, ladies and gentlemen, the advice of the day is peptides are great for your health, but they should be prescribed by the doctor, controlled and supervised by the doctor, and also purchased from the compounding pharmacy or through the compounding pharmacy, through the medical center, through the compounding pharmacy, and used for 2 months and then a break, or 3 months and a break, as prescribed by the doctor. So, Dr. Khalid, any other kind of aspects, nuances about peptides that you would want to share with our viewers?
Yeah, so the peptide, there are different ways to use it. We have different protocols. So we had a client a few weeks ago. He wants to go for a marathon of 100 kilos in 2 months. So we prepare a protocol in order for him to be well prepared for the 100 kilometer marathon. So he goes for, say, 2 months preparation of his exercise, plus the protocol, the peptides. He may use 3 peptides during this time, and then we switch during the time of the race. He goes to another form of peptides for injury healing. So that's one. The second, you can use it for different disease. We use for autoimmune disease, we use for cancer, we use for gut health, cardiovascular health. So I'll give you an example for autoimmune. We use 3 types of peptides we're targeting always. Is the immunity, so we reset and reprogram the immunity, and also we use for brain inflammation. We use that type of, and the gut, because these are the 3 targets of autoimmune disease. But we use these peptides. So there are different ways, but disease, anti-aging, musculoskeletal injuries, and different ways, mental health even we use it.
Mm-hmm. Very interesting. And actually, talking about case studies, we've had a patient, our mutual patient, Baida, who's been on bioidentical hormone therapy, and she's also done peptides twice within a period of, I think, 6 months. And guess what, ladies and gentlemen? She won an adventurous horse riding competition here in Abu Dhabi, and she won the gold medal, and she was a champion. So well done, Baida, and really good case study for us to mention while talking about peptides, really. So, Dr. Khalid, thank you so much for joining us. Thank you for your contribution to our podcast.
Welcome.
And very interesting talk about peptides. And would you recommend peptides 100% for a lot of many people who are looking for anti-aging, or let's say well-aging?
Yes, it is highly recommended to use peptides in a proper way.
Mm-hmm. So as the doctor prescribed, let's opt for peptides whenever we can. And thank you so much for everybody, to everybody for listening us. And any questions, please do ask at Medi-Gyn. info@medigyn.com or medigyn.com. Thank you so much and see you soon. Bye-bye for now.